Hi, I'm Lindsay Jost, one of the nurse practitioners here at the MaxWell Clinic. I am an Institute for Functional Medicine certified practitioner, and I am also one of the directors here at the clinic. I oversee our deep dive patient program, and I also oversee our new clinical process initiatives and the development that happens within the clinic, as well as special projects that happen outside of the clinic. It is a really exciting role, and I absolutely love what I get to do every day. I have a really interesting and unique background. So I initially went to nursing school at the University of Missouri, Kansas City, and I was there in an accelerated program after finishing a biology and chemistry degree in undergrad. I worked as a nursing assistant in the hospital at KU Medical Center because I initially thought I wanted to be a doctor. Ever since I was a little kid, that's what I was going to do. That was my mission, that was my goal, and I started working in the hospital to increase my level of experience. And as I was on the bedside with patients, I realized, wait a second, I love getting to do this. I love getting to care for patients at the bedside, helping them with their activities of daily living, walking with them through the most challenging and also joyous moments of their life, and nursing became a calling at a level I cannot even express in words. And so I shifted my focus, went to nursing school in Kansas City, where I worked after that for 2 years in an acute inpatient rehabilitation unit. I was a charge nurse there. I left Kansas City. I then spent a couple years doing travel nursing all around the country. And that was a really unique experience because it showed me what healthcare looks like outside of what we know and what we're comfortable with, and all around the United States, and how that's delivered in areas of opportunities. And at that point, I realized I'm not stopping until I get into functional medicine. And I knew that this type of holistic, root cause, looking at the bigger picture care was what I was put on this planet to do. And I found myself in Nashville, Tennessee, working at Vanderbilt as a clinical research coordinator at that time. A nutritionist told me, who was giving samples at the farmer's market, told me to check out MaxWell Clinic. I sent in my resume, and it's been almost 9 years since, and I couldn't be happier. It was one of the best decisions and callings I have ever gotten to fulfill in my professional career. MaxWell Clinic, unlike any other clinic I've ever been exposed to or healthcare facility, takes an approach to patient care where each patient is sovereign. They have choice, autonomy, and they're fully seen and heard. And I've never experienced that before coming to work here. That is a deep alignment with the way in which not only I see patient care, but also how I like to live in life, and I do my best to embody that in every interaction I possibly can. We are so complex as beings, and we are not just one thing. And so when patients are distilled down to a specific diagnosis or put into a certain box, the other areas that could be affected in their life often get missed. And so at MaxWell Clinic, and especially within our deep dive program, which is where I work and see patients, we take what you're focused on and what is driving you and your goals, but then we also don't forget about the interconnected nature of every other aspect of your care and your life, your relationships, your purpose, and why you're here. How can we achieve that, and how can we support you and your unique abilities and what you're meant to bring into this world? We are an environment here at MaxWell that is part of the deep ethos of what I believe, that we are always growing and we are always learning, and there's always the next thing that we can joyfully learn about ourselves and others and reflect back into the world. And MaxWell Clinic is at the heart, intertwined so deeply with the mission of what we're here to do, with everything that I believe as a clinician and practitioner. So part of what I get to do as being a clinician within our deep dive program, Dr. Haase and I had the joy of partnering together to create and build that into what it is today. All of our patients have 2 clinicians because we are deeply aware that we are only able to see through one lens of our own experiences. And so by partnering together in a dyad type of clinician program, we are able to have both a physician and all of the amazing experiences that Dr. Haase has had, and then myself and everything I've gotten to see, manage, and know in my own clinical experience, partnered together for a patient in a way that has had outcomes that we could never have even imagined. And so patients get to work with me by becoming a part of our deep dive program. I get to oversee our deep dive nurse team who coordinates all of the care. Our patients have a direct contact with me, and I get to be a part of managing their day in and day out care very intimately and closely. Relationship is one of the things I love the most, and our deep dive program enables getting to know people and see people deeply, and then following them through their life over time. There's nothing better than that as far as I'm concerned. So I hope that I get to engage and know you deeply, and anybody else who gets to come through our deep dive program and beyond. However, because I am involved in all of the other development aspects clinically within the clinic, you'll most likely see me around as well. I encourage you to reach out, say hi, and give a hug, and I hope to see you around MaxWell Clinic very soon.